Naughty Boy Phil and Phil Eulenspiegel. The Adventures of Phil Eulenspiegel when I was doing children's theater. But I think really I've better introduce Dr. Nasr. Although it makes me get up here and want to do something. Back in the 60s, this young man came from Egypt. He had a PhD in biochemistry. He had a degree in agronomy. He came to the United States to UCLA and did research. He knew that he wanted to do something beyond that, so he went to medical school at the University of Guadalajara. After graduation, he came to First Presbyterian Hospital in Chicago, where he did his internal medicine residency, and then he also did his residency in cardiology. Dr. Nasr is absolutely the most brilliant doctor that I have ever had the privilege of knowing. And I've known quite a few in my training at university hospitals in Madison, the hospitals that I worked at and taught, in the clinics that I've been associated with. I've just, been with some really neat doctors. But for you people who are new tonight, you really have a treat coming, because I loaned one of his tapes to a young lady a few days ago. And she said, after she had listened to the one that was on hormones, and she said, I never knew that such a complex subject could be explained so simply that anybody could understand it. So please give a warm welcome to this wonderful Dr. Mohamed Nasr.
Thank you. Thank you. Good evening. I don't know if you can make the light a little bit higher so I can see the people who are going to go to sleep or not. Yeah, just to make it, yeah, that's perfect. I know most of the people here, and they give me lots of inspiration to keep going, and I have lots of friends in the audience. I don't prepare the lectures, as you can see, and I just prepared it when he was introducing to me in the three letters right here, three words right here. That's the topic I'm going to speak about. Basically, every time we want to give a lecture, as you notice, what I'm trying to do right here is I'm trying to establish some kind of encyclopedia of nutrition that started in 1986. By the time I retired, I just said everything I want to say. All we have to do is publish it, and that will be the end of my career on it. And that's every time me and Joyce or any of my friends right here, we talk about a problem. We decide that this is a problem, a common problem among the people or not, and then we give a lecture about it. So the lecture is designed for the problems I see in my patients every day, or the people tell me about it. We decided to select the topic, speak about the fibers and alfalfa. And basically there is many reasons why we should speak about the fibers. And if we look at the lecture tonight about fibers, will be different from the lecture a few years ago about fibers. Because one of the things I am blessed by is I have the patience to go on and on studying from university to university, degree after degree, because every time I have a degree, the motivation I have was not the title I get so I can earn money. The motivation is I always wanted to know the secret God put in nature and the secret in human being. I want to know if I can find something nobody else found. I want to know if I can find incurable problem to cure some disease that nobody cured, so I make somebody happy. So the motivation always humanitarian in my life. Everything I have done since all my life actually that way. And that goes to the thanks, of course, to my parents that they brought us all that way. So when I see a subject is not well covered in the medical books or nutrition books, I just go ahead and give a lecture about it, just like we did with chronic fatigue syndrome last time. If you were here last time, and I'm sure lots of you were here, you were surprised actually by the amount of information you got on chronic fatigue syndrome because none of that, even you hear the Time magazine writes and the newspaper, none of the information I presented was presented in those magazines or those books. The reason behind it, because in every problem we have, the answer is almost simple. All the problems have a simple answer. Like we said last time, chronic fatigue syndrome was a simple thing. There is a fatigue, there is a criteria, there is a major criteria, there's minor criteria. I think a lot of you most of you read this literature or not? You had it, correct? Lots of you, and you read it. Anybody who have not have the paper on chronic fatigue syndrome, the booklet I distributed last time on chronic fatigue syndrome, call my office and we mail you one, free of charge. Because this is very important information to share with other people. I will give my phone number in the end of the lecture. Today, I also passed information, and I need one of those copies if we have extra copy that I can follow it with you. That also, I printed that today in my office to just cover. You don't need to look at it right now, but this is something you can take with you home and you can read on your own. Basically, we're trying to correlate the lecture today with the digestive system, the LDL, HDL problem, and also I will, talk about other problems of the digestive tract. To try to understand this problem, I'm going to explain something about fibers. What is a fiber? What is the structure, the chemical structure of a fiber? The fiber is made of cellulose. You heard the word cellulose before. Fiber is made of cellulose. What is a cellulose? Cellulose is a structure similar to starches, to a carbohydrate. It's a carbohydrate family. What is a starch? Starch is a structure made of sugar. So actually, if you take a sugar and look at it, you will find the sugar is built from a structure looks like this, a sugar. And it has on it many hands like this to grab on things inside your body and give you energy. That's a sugar. That is what a sugar is. If you connect two sugars together, that becomes a different sugar. This is right here is grape sugar, glucose. This is right here is the apple sugar. That is sucrose. And it's still a sugar. Sweet, if you ate it, what's the difference of a sugar? Sugar is something sweet. Not NutraSweet. We're talking about natural things. And if you connect another sugar to it, it will form another sugar, which was found in banana called galactose. That's the third, that's the sugar. It's not as sweet as apple sugar, and apple sugar is not as sweet as grape sugar. The simpler, the sweeter, the longer, the less sweet. And then we connect that to another one, a fourth one, and we form glue. The natural glue, that's what it is. They used to get out of acacia tree and stuff like that and used for a glue in the old days before synthetic. Or gum, chewing gum. The old chewing gum was like that. But was not sweet. As a matter of fact, it has a bitter taste. So adding molecule after molecule, God changes the taste and the structure and the shape of things in nature. Why do I say that? Because that's so important in fiber to understand the basics of nature. The basic of the carbohydrate family is what? The sugar. It's the carbohydrate family. Starts on the basic is what? Sugar. When you have sugars connect to sugar, it forms many things. And when you have about 50,000 of these connected together, that's form a starch, a bread. So starches has to be digested to what? Break down in the intestine to what? To sugar, to get energy out of it. This is why we said in lectures time and time and time, it is better to eat a starch than eat a sugar. Because starch is a slow energy release, where sugar is a fast energy release. When we eat starches, 50,000, we have enzymes in the pancreas called amylase can break this down to what? To what? To sugars. But when we exceed the number of 50,000 and we gone over that, 51, 52,000 to 60, 70,000, we no longer can digest that. Our enzyme cannot break it anymore. And we start to leaving the starch family. When we get two starches, connect them together, becomes 100,000 of those, we form a cellulose, or a piece of wood. So a cellulose is wood, it's fiber, and if you take a piece of wood and digest it with a digestive enzyme we don't have, it will give us a starches. So we can take a piece of wood and mix it with a specific enzyme called cellulase, and we have next morning starches, and we have no problem. We can eat that out of wood. And if we take starches and mix it with digestive enzymes, we can have sugar in the morning. And that's how maple syrup was made. Where the tree has starches first, has wood first, it broke it down to starches, it broke it down to syrup for us. And that's how sugar forms. If you eat an apple, not ripe, is not sweet. A banana, not ripe, is not sweet. But if you leave it long enough in the tree will give it the enzymes to break it down to what? To sugar. And the longer you leave it, the more sugar it will contain. You understand? It has the same calorie either way, the same amount of calorie. So, why then do we have sugar, starches, and cellulose? Why do we have that? Sugar is a source of energy. Starch is a source of energy. What's a cellulose for then? Cellulose are fibers, the same thing. It's nothing but a long chain of sugars connected together that we cannot digest. Remember the word. You cannot digest the fibers. The only creature can digest fibers are bacteria or funguses. They can grow on wood and rot wood for us easy. They can do that. We don't have this enzyme. But animals like cows, that they have 4 stomachs, they can do that. We don't have 4 stomachs. They have 4 stomachs, and they have an enzyme called cellulase. They can break wood to sugar. So a cow can live on wood, can eat wood and have sugar and have energy. Where a horse cannot eat wood. He has to eat alfalfa to live. A cow can eat the tree, he can eat the leaves. And that's how nature, wonderful, is designed. Each creature does something, and the whole chain is designed for the service and benefit of mankind in the very end. Mankind is the ultimate creature, the most sophisticated, the center of everything. Everything works in the benefit of that mankind. If mankind cooperates with everything else, not destroy it. Of course, man is always have the ability to build and destroy, and that is the problem we have these days. Cellulose, we can get it just like cows. but it doesn't give us energy. What does it give us? If you look at cellulose molecule, you find it is built from 100,000 units, like we talked about before, and it has these hands in it. And when you look at cellulose, in nature, it's coiled like this. It is not a long 150,000 long chain. It's coiled. Are you following me? Everything in nature is coiled. The DNA is coiled. The RNA, the protein is coiled. Everything has to be coiled because we don't have space to have, if you have a piece of chicken you're going to eat and you stretch it, it will be here to the highway. We don't have time to keep eating all that one after the other. So God made it in one little ball, and then we can swallow the whole thing, and the whole thing can loosen inside us. A piece of cellulose or fiber is like this. We have all these hands together, and those hands are hungry to catch something. They want to grab on something. If you loosen them, if you take a piece of fiber, piece of wood, and soak it in water, it will expand. Correct? Wood will expand. Why? Because they love to grab on something, on water. If you have oil spilled and you throw bran or fibers on it, it will suck the oil. It loves sucking on everything. That is fiber. It is no different from fat we eat. It's also coiled, or protein, or carbohydrate, or any of those that are also coiled. But let's talk about fiber. What's the benefit I'm talking about these fibers tonight? The benefit is tremendous. For years, we have said for the human body to function, this is the human body right here, to function properly and build brain, heart, intestine, liver, pancreas, lung, and you name it, you need the cells inside the body, they need food. What do they need? The cells, they need food. What do they need? They need protein, carbohydrate, and fat, vitamins, water, mineral, and oxygen, correct? We said that in many lectures. How would the food get inside the body? How does it get inside the body? Not the oxygen, of course. How does the food get in? Through the digestive tract. We eat it, we digest. Let us follow the food in the digestive tract right now and see how can we improve our digestion using fibers and the role of fibers in the digestive system. And after we talk about that, we will take a trip with the food inside the blood and see how this works with each other to lower the LDL and increase the HDL. First of all, as I said before, this human body is made of organs. The brain, the heart, the bone, the skin, the lung, the glands, and all these organs we talked in many lectures, they're all made of cells, and the cell requires what? Food to produce what? Energy, enzymes, hormones, whatever the body needs. To do that, we have to go through the body, through the digestive system. The digestive system starts in your mouth. The mouth has glands in it called what? This is your upper lip, this is your nose right here, this is your mouth right here, and the tongue is right there. The food has to go in, eventually has to go to the stomach, and eventually has to pass by what? The small intestine, and eventually goes to the large intestine, and eventually comes out of the body. This is the trip a food takes. If we study the anatomy of the mouth, the anatomy of the esophagus, the anatomy of the stomach, the anatomy of this, the anatomy of that, we know why we need to take certain supplements, why we need to take fibers, why do we need to take vitamins, why we need to take minerals, why we need to take vitamins, and why we need to take vitamins. This is how they work inside the body. The salivary gland secretes what? Enzymes. The more you chew, the more enzymes come and breaks down the food, breaks down the carbohydrate little bit rather than 50,000 molecules. It breaks down to 10,000 molecules. And then it comes right here at 10,000 molecules of what? What we're talking about? Of starches, not sugar. That's the digestion. People who do not chew their food long time, the starches, and they swallow it fast, do not digest it probably in the mouth, and they put a burden on what? On the stomach to digest, and it takes longer in the stomach. When it takes longer in the stomach, it makes gas, and it ferments, and the bacteria takes advantage of it, because it makes gas in the mouth from there, you get it out, and but if it makes in the stomach, it has more fermentation to it. So chewing is the most important thing. The food comes down right here, and it gets digested some more. And we have in the stomach hydrochloric acid. In the stomach, we have a valve that closes here, and it closes here, and the food will be like in a washing machine, exactly on and on and on, go moving around, and it keeps just like a washing machine for a period, just like washing cycle for about 1 to 2 hours. For 1 to 2 hours, the stomach keeps mushing everything together. Mixing hydrochloric acid with it, mixing enzyme with it, and the food gets digested. The protein gets broken down to a smaller chains. The fat gets broken down to a smaller chain, and the carbohydrate gets broken down to a smaller chain. Then the food passes by where? The small intestine. When it passes the small intestine, this guy here, what's the name of it? The pancreas secretes juice. What does it secrete? Secretes enzymes. More enzymes come out and do the final stage of breakdown. Breakdown of protein to amino acids, and fat to fatty acids, and starches to what? Sugar. And the vitamins, mineral, and water go inside with it. All this in the small intestine. Then the food will pass after that to the larger intestine. Where in the larger intestine, right here, water will get absorbed and vitamin B12 will be made by the bacteria and absorbed. Now, the most important two things we have here is digestion and absorption. You follow me? There's a digestion and absorption. You could digest your food. You can eat fine, digest it. But if you don't absorb it, then you have a malabsorption syndrome, and you still feel tired and fatigued and have no energy, even you ate enough food. You follow me or no? Or you might absorb the food, but you absorb in the wrong food. You might absorb the fat, but not the starches. You might absorb the sugar, but not the amino acids. You don't have good absorption, and we call that malabsorption syndrome. That's somebody who's eating fine, and they have problems in their blood. What are the symptoms of problem in the digestive system? What are the symptoms if you have a problem? First symptom in the abdomen right here, digestion symptom. problem with digestion. Such as what? Such as gas. Formation of gas means the food is sitting undigested for a long period of time, and the germs, the bacteria and yeast that you have inside is taking advantage of it, eating it themselves and forming their waste gas, not our gas. You follow me? And you get this burping, and you get this belching, and you get all of that because this here is not digesting properly. There is a problem with that. When you have so much problem with digestion here, the acid will go in the esophagus here, and you start having heartburn, especially at night. Burping and having an regurgitation. Some of the fluid might come out even and burn the throat. And eventually, parts of the stomach will start bulging in the chest, pushing the heart aside and come out. We call that hiatal hernia. So hiatal hernia is something, it's not serious, but it is very uncomfortable and can lead to many problems. Number one, you have acid coming out in the esophagus. Eventually, you're going to have burned esophagus from the acid, digested esophagus, and you cannot digest, you cannot swallow properly anymore. Sometimes the food gets stuck in your esophagus, and that's a problem. Some people can take a piece of meat and stuck, and they could die from it. Another problem is some of the acid can come at night when you sleep and leaks and go in the lungs and cause cough. And have you ever regurgitated and it goes in your lung at night? It's really miserable, feels bad, you feel like you're going to choke, you're going to die. And if that happens all the time, then you have bronchitis and asthma and problems like that. Another problem with the stomach right here is too much acid, and you have an ulcer formation. But the main thing, digestion didn't happen properly. So the food will pass undigested to the intestine, and the bacteria will work on it and cause problems in the colon, either diarrhea or constipation. Now, what is the role of fiber here? When you look at the fibers, the fiber in the form of salad, these are fibers. Any vegetable is a fiber, and any stem of a plant, like any stemmy plant, has a fiber in it, and any grain comes right here, it has some fibers in it. So when you eat all of that vegetable with the meal, when you include that with the carbohydrate and the fat and the vitamin, you have the salad with the meal or before the meal, and you don't add too much protein to the salad like cottage cheese and eggs, or add too much fat to the salad such as all kinds of greasy stuff, or you don't ruin the vegetable, because vegetable is so important to us for survival because it is coiled. What do I mean? Because it is coiled, it is so important for us. These coiled vegetables, when you eat them, when you chew vegetable in your mouth, it does help the mouth. Vegetables, chewing salad, after meal, or before meal, or during meal, salad clean the teeth. Salad clean the teeth. Right? Animals that they eat vegetables, they don't go to the dentist. They have good teeth. The horses, cows, and all of them have very good teeth all the time. They don't need any problem. Because vegetables, in general, scrubs when it goes in and polishes the teeth. And also vegetable made of green substance in it. Besides cellulose, right here, it traps in it a green substance in it called what? Chlorophyll. What is chlorophyll? Chlorophyll made of two molecules of sugar connected with a long chain, like this. If we combine them together, we call it alpha and beta carotene. That's chlorophyll. When we split it here in the middle, we have a beta carotene and alpha carotene. So green vegetables is a good source of what? Of beta carotene. Yellow vegetables, of course, have more beta carotene than green vegetables, but they both have the same quantity in the end. When you eat chlorophyll, it has the ability to absorb gas. Chlorophyll likes to absorb gas. So a chewing vegetable will get rid of bad breath of the mouth. And having the vegetable chlorophyll in the stomach, have it in the stomach with the fiber, remember the coiled fiber, the coiled fiber starts what? Expanding in where? Where are we now? In the stomach. And it gives you the sense of fullness. So if you eat lots of grains and vegetables, especially Chinese food and stuff like that, you feel full because it did expand and you don't eat that much anymore. But later on you get hungry faster because it doesn't have the calories you were looking for. This is why we get hungry from Chinese food. Now, when this expands, it shuts your appetite. So if somebody wants to go, and remember, the topic today is fiber, and I know we have indigestion and stuff like that, but the subject I'm speaking about is a lot more what's in the paper right here, because we're taking the dental problem right now, hiatal hernia problem, going to ulcers, to bad breath, all of that we're going down the chain more than the topics right here say. Then this will go to the stomach, and if the stomach is full of green substance, you will have less odor. Number two, you'll be full, but if you eat the salad before the meal and slow down, and you eat large enough salad and drink enough water with the salad, your stomach, the fiber is expanded already right away, and what will happen to the appetite? It is not as much. It doesn't matter how low blood sugar you have, how hypoglycemic you are. If your stomach is full, you do not have craving for sweets. The stomach has to be full to get rid of the craving of sweets. And fibers are the best way to do that. So we talked right now about weight loss already, how we lose weight. For example, you take alfalfa, it's fiber. 20-30 alfalfa, it has as much fiber as large salads. And also, 20-30 of alfalfa has as much fiber as 2 tablespoons of hot plant, or as much as 4 tablespoons of the fiber powder. So there is a variety of things one can do to slow down the appetite, improve the digestive system right here, from alfalfa to salad to hot plant to fiber, anything you want, you can do anything you pleases. If the object is not cholesterol, will do just fine. The fiber eventually will come right here. The opening here is smaller than the opening here or not, right? Now we come into a smaller, tiny opening called the small intestine. Let us look at the small intestine under the microscope and look and see how do we absorb. Now we get into absorption. Digestion, finished. We go into absorption here. Because if you digest and you don't absorb your vitamin, you don't absorb your calcium, you don't absorb your minerals, then you're going to have malabsorption. And if you're waiting for a doctor to find out, you are mistaken. Malabsorption is a very, very misdiagnosed disease because there is not too many tests that can diagnose it. There are tests to diagnose malabsorption in advanced stage, just like any disease. But early stage, doctor will look at you and say, you look fine to me. You don't have problems. You don't need anything else. You don't need vitamins. You don't need minerals. You don't need nothing because you look fine. As a matter of fact, a patient told me today, to go to a doctor having to do something, she has to not wear bad clothes, not to have any makeup so she can look sick, so he can give her treatment, because if she look good, because she take a vitamin, she says, oh, you're fine, you go see a psychiatrist. That's sad that somebody is not believed. Because it doesn't matter how good you look from outside, it's the inside what counts. You can look good outside, you're miserable inside. People who commit suicide, they look good outside. That guy right here, that crazy guy who shot people in Milwaukee, he looked fine from outside. You cannot judge the book from its cover. You've got to know how you feel inside. And the doctor doesn't do that. And that's one of the reasons of our family problems. And we don't know how each other feel inside. We take only the outside. And that is our problem, one of our problems in life. Now, let us go to the intestine and see what it looks like. The intestine looks like this. When you eat carbohydrate and fat and vitamins and water and mineral only, this is the size of your intestine. And the intestine have a little hair inside called the what? Not cilia. Villi. Yeah. Cilia in the lung, villi in the intestine. It's similar to cilia, but the difference, cilia move like mustache of mosquitoes of grasshoppers, like cockroach, where villi absorb, they don't move. If you eat fiber with it, it's this size. What's the difference between this is the same vitamins, water, mineral, carbohydrate, and fat, and fiber, and this is without a fiber. What's the difference? Because the fiber expand, right, with water. How powerful are fibers when they expand with water? How powerful do you think they are? Ancient Egyptians, we are ancient Egyptians, and our ancestors, which they were very sophisticated in almost everything in nature, they thought about that. To build a temple, how are you going to break this mountain? They don't have tools. So if you go to Aswan in Upper Egypt, where they got the granite, they went to the mountain, they smoothed it very nicely. You can do that with, polishing it. But how did they cut stones out of it in perfect shape without tools? And until today, you can see the proof. They go in, and they go to the mountain here and dig holes. They make holes right here, and every foot there is a hole, and they fill it with sawdust. And they put water on it, and they fill it with wax. The water expands at night. By the morning, it cracks the rock, and you have a straight crack across like this. It depends, and then they go deeper and deeper and deeper, and that's how they did it. You go there, you see the unfinished obelisk near the dam. You see the obelisk and the holes right there in it, and that's how they cut it. So the power of fiber is unlimited. A piece of wood can lift a building like that up if it has enough water and no other space to expand except to about it will do it. There's no power can compress hygroscopic power, water and tissue together except atomic power. But this is how much power it has to expand. So Here the fiber expands. So the more water one drinks with it, the more it expands. Is that good or bad? Why is it good? Because this part of your body is specialized in what? Absorption, right? You want to absorb. How does the body absorb food? How do absorption occur? Absorption occurs very scientific. Right here we have cells. And each cell of the intestine specializes in absorbing certain nutrients. So when the food passes in the intestine right here, when the food passes in the intestine right here, then this section, for example, will be water-soluble vitamins, all the cells. This here, for example, will be fat. This here, for example, amino acids. This here, minerals. Every section is specialized in something. Are you following me or not? How do they do that? The food is already mixed all together, and what happens is the food has to sit in front of what? The cell. Exactly right. The food has to stand in front of each cell and wait for approximately 15 to 30 seconds. Sit in front of it and stick with it and wait 15 to 30 seconds. And if the cell doesn't absorb, then the food moves to the next cell and to the next cell. If you don't want me, maybe the other wants me. If you don't, maybe the other will. And keep moving around down like this, checking to see which one is going to absorb me. You understand? That's how the selective process works. This cell will open its mouth and take the food and put it inside its stomach right here. The process, it has many names. Osmolarity, phagocytosis, you name it, there are different things absorbed different ways. And the food will go inside where the blood. Go in like this. Now, which one of those, A or B, will absorb food better? And why? Which one of A or B absorbs food better and why? B absorbs better and why? More what? More surface. More opportunity, more surface. The bigger the surface, you're stretching all the cells like an unfolded coil, they can't absorb. Now they stretch and they hug the food, they can absorb much better. So that's another benefit of fiber to prevent malabsorption. So if we have somebody have a malabsorption, we give them lots of fibers, salads and stuff like that, their absorption will be better. As a matter of fact, animals that depend on fiber for absorption are healthier than animals that depend on less fiber for absorption. You take a look at two animals. Look at vegetable-eating animals. You find has bigger bones and bigger muscles, like the horse and the elephant and the cow and the camel and the giraffe and their family. And animals that depend on more protein-concentrated food, like the cat, the rat, the lion, that is not as healthy as the other. So this is the best way for us. Human beings are built in between. They can have both, or they can digest protein, but they can also live on fibers. Can we live on vegetables? Yes, we can live on vegetables, like horses can. We can, because in every salad you eat, not only is going to help your mouth and get rid of all the plaques and germs, and also it's going to be in the stomach, going to get rid of the bad breath, especially in the evening, then you don't have problem at all. Vegetables don't cause gas. Vegetables cause bulk stool, but no gas. And even the cold gas is not smelly gas because it's a carbon dioxide gas versus protein gas. It's a putrefied gas. So it's different type of gas completely. There is a big difference between the gas comes off a dog or a cat and a horse or a cow. It's a difference. This doesn't have any bad aroma. This has a bad because it's a different metabolism, digestive system, one with the other. Human beings is like the cows, like the horses, should be like that. For each salad you eat, also each one big salad is equal to a glass of milk. You get as much protein off it as a glass of milk. And here somebody has to ask the question, how can we get protein out of cellulose when we cannot digest it? You said we cannot digest fiber. How do we get protein out there? How do we do that? Because we don't break it. It's still long chain. But each animal cell, plant cell, you eating the cell itself, which has the cellulose inside it. Around the cellulose there are vitamins, there are minerals, there are proteins, and when you chew it, it's just like grapes. It breaks, and the fibers comes out, but the good stuff will still absorb in our body. You understand that or not? So not all the vegetables come out, only the roughage comes out, but the good stuff is being absorbed out of it. You follow me? And I think some of those vegetables also have digestive enzymes. Like if you have a heartburn, too much acid. You know that chlorophyll is one of the most potent antacids. If you have a heartburn and you eat vegetable, green vegetable, lettuce, the heartburn will go away. And try that. Better than antacid, better than protein, better than calcium. Or any fiber. If you have a heartburn, and just take fibers in water. It's more gentle. It absorbs gas, it absorbs acids, it absorbs everything to itself and protects you from it. This is how fiber works inside to improve absorption. Then we go after that to the last trip, which is what? The colon. What the fiber going to do in the colon? We have two pictures. One picture is the colon of somebody who do not have fibers, and the colon of somebody who eats fibers. This colon right here is larger than the colon here. What is the advantage of having a larger colon versus a smaller colon? What's the advantage of that? Any advantage? Yes, there is advantage. Because the colon itself is a waste disposable basket. It's the end line, the end of the line. Everything dumps there. Everything is not digested is there. Every chemical sits there. You understand that? And for that reason, let us suppose that this fellow, besides eating vitamins and all what he has done, he has some chemicals coming in the food. The chemical mixed in the stomach for 1 hour is not going to cause problems. Not that much. The chemical in the intestine, 15, 20 seconds, 30 seconds in front of it, is not going to cause problem, cancer. You don't see cancer of the small intestine. When we come right here, those chemicals sits right here, and that thing dried, the print, we can throw that away. Okay. These chemicals, they sit right here, and the colon have those hairs also, and the chemical sits where? In the folds. And how long does the food sit in the colon? It sits in the colon about 15 to 18 hours. We're supposed to have 1 bowel movement a day. having 2 bowel movements a day, it's okay, but it is little bit abnormal. For somebody who ate reasonable amount of food should have 1 bowel movement a day. 2 bowel movements every 18 hours is okay also. But having 3 bowel movements a day or 4, that's too much, and that means the food doesn't sit long time. When the food sits, the waste sits 15 to 18 hours, these chemicals will irritate what? Will irritate the lining of the colon. When it irritates the lining of the colon cell right here starts growing and forming what we call polyps. And the polyp will change to what? To cancer. So having fibers, what we'll do? We'll leave the chemicals not in the food, and because we have so much fibers around it, the fibers will grab them and keep them inside. What do we do for a child when I was working in the emergency room, for example, who swallows a needle or a piece of glass? What we do? Do we go in and get it out? No, we don't. What we do when they swallow coin? We don't. A pin? We don't do any of that. We let them have lots of fibers, charcoal, because the fibers will engulf the needle and surround it, and then it comes out in the middle. Because the fibers tend to be the outside one always, and keep everything inside to protect the body. So the fibers protect against chemicals and decreases cancer. But there is another problem, and that problem is the following. People who eat not only carbohydrate and protein and fat, they eat the wrong type of fat. They eat animal fat. They eat chicken fat. They eat fish fat. They eat all kinds of animal fat. What is the difference between animal fat and vegetable oil? What is the difference in the chemical structure? The difference is animal fat is saturated and vegetable fat is unsaturated. What does that mean? What does the word unsaturated mean? This is a chain of oil, and this is a chain of fat. The oil have hands on it. It's open. Then when it goes in your bowel, it combines with the bile. When it combines with the bile, it gets absorbed and converts to good stuff inside, hormones and all kinds of good things inside your body. So oil, it never converts to cholesterol. And oil, it can't convert. It can make you fat. If you eat lots of oil and you don't exercise, it can benefit you, form your hormones. It can benefit you, get rid of some of the chemicals. It can benefit you by not forming cholesterol, but it can't form a triglyceride if you don't burn it. But here is the large or animal fat is already saturated. What is the word saturated mean then? Huh? Full. Full of what? That's exactly the word I'm looking for. Full of what? What is full? Look what happens. We can take oil in the laboratory and expose it to hydrogen and hydrogenate it and fill it with atoms of oxygen material and make margarine out of it. So being full, is it good or bad? Bad. Because actually we need it unsaturated. Why we need it unsaturated? Because you need everything to go inside your body unsaturated. Everything has to be unsaturated. Everything. Once you eat something saturated, how is your body going to get rid of it? See, the human body works on grabbing each other, grab a chemical, grab a poison, grab a fat. You see what I mean? It's all double bonds in chemistry. How is going to get rid of something already saturated? You see how difficult it is for us. This is why something like cyanide is very poison, because the human body doesn't know how to grab it, how to get hold of it. It goes in, and the body cannot get rid of it, so it kills it very fast. But DDT, it will not kill us fast. Or melathion, it will kill us eventually, but not as fast as, because one is more saturated than others. This oil is different from that fat. When you eat that fat, then what does it do inside our body? First of all, the gentleman says it is saturated by something false. Many times the fat we're eating out of chicken or fish or pork or cow, that animal ate it as what? Ate it as what? As unsaturated. They ate it, the cow consumed it in the soybean as unsaturated. What did they do with it? They used it in their body to get rid of their oxidant material, the chemical, the free radical in their body. You see the hay, the alfalfa, it has chemicals on it. Then they eat it, and those oils just grab all the poison, and they store it in their wax, in their lard, in their grease around their body for heat, for source of energy, for whatever. When we eat that, not only we're not getting the unsaturated, the protection from unsaturated, we're getting a dose of what? A chemical. The chemical will sit in the intestine right here and cause cancer. Fiber have the ability, when it sees that, to grab them in their coil and takes them right here. Because the chain of fat is much smaller than the chain of fiber. And fiber can expand so huge and grabs fat. Fiber grabs everything. And that is why the fiber can protect us against this fat. This fat, the saturated, when it breaks down and it goes to the liver, it is not in the same form as when it goes to the liver. This is the intestine right here, and the liver is right here. Normally, the oil goes in, the unsaturated, and with the vitamins and everything, it breaks down to HDL, especially with beta-carotene and vitamin A and all the vitamins. The liver needs to do that. When we don't have enough vitamin A and beta-carotene, what is the difference between you heard about HDL, everybody here? Did you hear about LDL? Anybody doesn't know what LDL and HDL mean? You tell me and I explain it. So everybody knows what the LDL. If I ask a question to anybody here, you're going to tell me what the LDL is. Okay, let me ask a question now. What does the LDL mean? Stands for? Low, let's take it slowly here. Low density lipoprotein. So it is made of two components, lipo and protein, right? What's lipo mean? Lipo is lipid, is what? Fat. What's protein mean? Protein. So the liver combined the protein to the fat and made this low density. You know what the low density means? A little piece of fat. connected to protein is low density. It's a lightweight. Lightweight fat is very dangerous because lightweight fat, when it goes inside your blood, it floats. And when it goes in the heart, it floats. In the brain, when you sleep at night, it can't float. And that's bad because it can plug arteries, it can cause stroke. So the body connects these together and makes high density lipoprotein. High density lipoprotein because it's thick. When it travels, it doesn't stick to anything. So it is good to have high density lipoprotein traveling more than low density lipoprotein traveling, correct? And vegetables like beta-carotene and vitamin C and vitamin A help to connect that together. How did the fiber get in the picture? How did the fiber get in this picture then? What did the fiber do right there? Does anybody know? Okay, the fiber, remember the first of the lecture, what I said about fibers, that human being cannot what? Cannot what? Digest fibers. So fibers never enter the bloodstream. So fiber has nothing to do with LDL and HDL. All fibers do, they get rid of all the grease in the intestine that before it goes in the blood. That's how it lowers the total fat content, the cholesterol content. But it does not enter. As a matter of fact, I heard a nutritionist and physician MDs telling the people that the way it works, it goes in the bloodstream and gets rid of the LDL. That's wrong. Because if a fiber can enter the bloodstream, it will cause a stroke. It will cause embolism. Because every cell has to travel inside our capillaries. It has to be smaller than the capillaries. It has to be. Because if it goes between the cells in the brain and it cannot go through, which you have about 4 or 5 microns, then you're going to plug and you're going to have problems. And fiber definitely bigger than that size. So actually, that we know that fibers work only where? In the digestive system. Is it important for somebody who have, I'm going to make you a cardiologist now, somebody who have high LDL, low HDL, because he eats too much fat, wrong fat. Is it good for him to have lots of fibers? The answer is what? Yes. How about let's go to somebody else? Let's go to somebody who's thin, who in hereditary, his liver makes the wrong kind of fat all the time. It would fiber benefit him? How? They're going to benefit him. They're going to block the fat coming in his diet, then he has to depend on what he makes to burn rather than get it from outside. You got the idea or not? That's how it works. This fat, when it goes inside the arteries as LDL, it precipitates inside the arteries and causes blocked arteries with cholesterol. So LDL is more dangerous than cholesterol because low-density lipoprotein is not cholesterol. Cholesterol is part of it, but it is combination of fat and cholesterol together. So you can avoid all the cholesterol you want. If you don't watch your triglycerides, then you're going to have plugged arteries still, and that's more dangerous than cholesterol. Now, we have covered the 3 points I wanted to cover, which is basically what are fibers made of. Number 2, the digestive system we have, what kind of diseases we have in it in the mouth, like tooth decay, the answer, one of the answer, vegetables. Dry mouth, one of the answer, vegetables. Bad breath, one of the answers are vegetables. Lack of lubrication in the esophagus, the food gets stuck. Vegetables will help with the lubrication. In stomach hiatal hernia and ulcer, vegetables will help with that. Absorption in the small intestine, you will benefit more from your food if you have salads with it than without salad. The colon will help against constipation and also will get rid of most of the toxic substance that causes polyps and cancer of the colon. Then we go to the last benefit. It does combine the fat and lower the amount of triglycerides going to the liver. So it does lower the LDL indirectly, but not directly. What lowers the LDL directly then? And that's not the topic of tonight at all, but I'm going to cover that in a lecture on heart disease and circulation, which will be coming in next year. But the way it works, of lowering that the beta-carotene and the vitamin A and the vitamin C and the vitamin E and EPA, these are the stuff that lowers the LDL and increase the HDL with exercise. But the fiber does not do that. Okay. I'm going to take this brochure right here. I was asked by the city of Hoffman State, close to the airport in Chicago, to have a health conference in the Park District. Then I went in, I printed some stuff for the public to take, and this was one of them. To tell you what's a bad cholesterol, what's a good cholesterol, and then all of these things, and give you just general idea. In the bottom of that, you will see the two phone numbers, which one of them is down here, 3569009. The area code says 312. It's now 708. And the other is 843-8860. It's my other office. The next lecture, God willing, we'll be talking on cancer. Right here. That will be around close to the end of February, regardless of the weather, unless it's a blizzard, then God willing we'll be here. And if it is blizzard that you see no cars in the highway at all, don't come. But if you see one car, come, because most likely we'll be here. Okay, so the other thing is there is a lecture coming I'm going to be giving about Lyme disease to the Lyme Society here in some place. I forgot to bring the piece of paper with me. I intended, in Waukesha Memorial Hospital? Okay, what day? Call my office and we'll give you the date. Yeah, this is the Lyme group, the Lyme support group, and I'm going to lecture to them on Lyme disease because it's a very bad disease. So we are covering basically in this area the major dangerous problems. Chronic fatigue syndrome we talked about, high cholesterol and plugged artery we talked about today. We'll be talking about Lyme. We'll be talking about cancer. And if you follow what's in the lecture, you save yourself lots of money going to doctors and many problems in your health also. So lots of these answers in your hand if you can do it right. The main answers tonight are fibers, salads, and vegetables, and alfalfa. What's the difference between different fibers, short fiber, long fiber? They're basically the same. Neither of them get absorbed. But house plant, for example, will absorb 5 times more fat than alfalfa. And alfalfa will absorb twice fat than salad. So actually, that's why houseplant is, if you eat so much of it, it gives you diarrhea. Basically, because it takes so much water, it gets so big, it gives you diarrhea. Well, that would be a great thing for weight loss, for dieting. You eat a houseplant, alfalfa, and fiber for breakfast, lunch, and dinner, and you don't eat anything. You lose weight and you have diarrhea. No, we don't want to do that. But at least it's a hint to you better than going to Nutrisystem and all of these places. Basically, it's a more efficient way. Hunger is the main reason of weight gain. And we're getting right now in the season, we're going to gain lots of weight. So hunger is the main problem. Depression is the second problem. And so the best thing to do, just eat vegetables. And if that is bad and you want something fast, get 2 tablespoons of fiber, 1 tablespoon of hard plant, dissolve it real fast in something you like, juice or whatever, and drink that and wait before you eat. You'll be full with that. If you want something with it, it doesn't taste good, that's not my problem. You know, you have to make it taste good because you can make it taste good. I'm going to be taking some questions, but I will put my phone number for the people who cannot read it, and there the phone number is 708-356-9009. The name is Nasr, N-A-S-R, and then if you want to call me, leave a message, I will call you back. Any questions? Yes, ma'am.
I have a customer that has celiac spur disease. He's allergic to wheat, rye, oats, and barley.
Celiac spur disease. Okay. Malabsorption syndrome will benefit, I treat it all the time, will benefit from that plant, those vegetables, like I said. The question was celiac disease. Celiac spur, it's malabsorption syndrome. They don't absorb lots of things, and they get very thin, and they have osteoporosis, osteomalacia, and they break their bones, and they have problems. And the best thing for them is to get in that plant's life with lots of vegetables, and they will absorb eventually. Because the villi done with those people. You look at the intestine, it's like this, like glass inside. That is why. The food just slides through.
What kind of vitamins do you take?
Well, they don't absorb anything. They don't absorb. So what all vitamins good for them in a small quantity or liquid form. But the best thing for them to get a fiber, because the food's not going to sit anyway. You need the food to sit for 15 to 30 seconds. So you better use what? A fiber to hold it in place. The other thing is this, instant protein. It has amino acids that it helps to build the villi. Another thing, there is specific amino acid is not in the instant protein, and you find it in the chicken soup. It has glutamine chicken soup, which is not in vegetable protein at all. The glutamine helps to also build the villi. So a chicken soup still stands as a good, healthy diet because it does have lots of amino acids. Not with the fat, of course. Yes? Yeah, the soluble or basically that's what I said in the earlier. Soluble, there's no such thing called soluble fiber. But let us just give you the example. The long fiber, when you take it and chop it to small fibers, those fibers are still 150,000 each, by the way. They're not shorter than that. But these fibers, here's the long one, they many 150,000 connected together, stuck together. So when we take these fibers right here and put it in a microwave oven and loosen the chain and separate it from each other and put something so they don't stick to each other, we have a smaller chain fibers. Both of them don't dissolve in water. Just like the calcium and the protein in milk. Is the calcium and the protein in milk dissolved in milk or not? If it's dissolved in milk, the milk will be clear. The reason the milk is white because it's not dissolved. It's a colloid. It's hanging there, but it's not dissolved. And that's what's a short fiber. Short fibers, like in heart plant, will have more absorption than long fibers. But they also cause diarrhea if you have so much of them. Longer fibers, like you mix chocolate fibers longer and shorter, will be a better way than taking the heart plant alone. So 1 tablespoon of heart plan, 2 tablespoons of fibers will be better than heart plan alone. Yes.
They'll be the same taking heart plan. I've talked to people, myself included, I get headaches and nausea from heart plan.
Yeah, headache and nausea from heart plan, you probably, it expands so rapidly, your intestine is small, and that's what gives you the nausea. Or it causes irritation somehow. The best thing to do, just take it after meal and a smaller quantity and build your intestinal size. Yes? Okay. In the colon is about 15 to 18 hours. One bowel movement every 18 hours approximately is the normal for human beings. 3, because that means the transit time. See, the colon is what tells you to eat. If your colon is full, it doesn't let you eat more. You get obstruction. It controls appetite, the colon does. And if you have a colon that empties rapidly, you eat more rapidly. Then you gain more weight. The other thing is this. The colon itself needs about 15 hours to make vitamin B12 and folic acid. Because vitamin B12 and folic acid is made in your colon by the bacteria that's in your food. So you make your own vitamin B12 regardless if you take it or not. If it is, if you have fiber in there a long time, it doesn't cause problems. If it is solid food without fibers, so it sits there, it's mushy, it doesn't have the consistency of fiber, then it can contribute to cancer. Is that clear? Okay. Yes.
I have a question regarding the same thing. Now, if a person is having many bowel movements a day and eating a lot of fiber, is there anything that you can do to correct that?
Well, he eats too much fibers. Yeah, if you have lots of bowel movement a day, that means too much. You can be the opposite. You know, if you eat too much fibers, then you're gonna have problems. You know, you have too much bulk, and then I think it's a solid bowl, like I said, with each meal is enough. But if 2 heads of lettuce and 3 heads of lettuce, it's gonna be too much with each meal. You know, I mean, there's limits to everything. There's only so much size one can hold right here. And then when it gets more than should be, then it has to come out. And when you have more than one, when you have 2, 3 bowel movements a day, you're really losing lots of fluids because it takes about that much to absorb the water back in the system. And you become dehydrated. You lose a lot of water. Yes, I agree with you. Shakla Herbalax is not part of this plan at all. Because Shakla Herbalax is only for the people who don't want to take fibers. For the people who don't want to take alfalfa. But Shakla Herbalax is for people who are in nursing home. That they can't. You see, fibers alone is not going to make you go to the bathroom. Fiber and water and movement makes people go to the bathroom. Fiber, water, and exercise. So when you wake up in the morning and you move around, you go to the bathroom. But as long as you sleep with the fiber, you still don't go to the bathroom. Because movement, it stimulates the colon. So Herbalax is a good stimulus. It does stimulate the colon. So it is not the natural way we want to do it. But it should be preserved for people who tried the fiber, didn't work, exercise or water didn't work, the heart plan didn't work, the alfalfa didn't work, then we can give them 1 Herbalax or 2 Herbalax or 3 or 4 every night then. But what I have seen in my practice, people becoming lazy, they don't want to take the fiber, then they take the Herbalax. No, it is not good to take on a daily basis. You have to depend on the fiber first. And if the fiber doesn't work, then check your thyroid and other stuff. And if that doesn't work, then go take a castratic agent like alfalfa, like Herblax. But what happens is that they both have their role. You got to know exactly where each supplement's role is. Not just saying, because the company sells this, we're going to take everything. No, you're going to take what you need. Because if you don't do that, you're going to get discouraged and say, that's too many pills, I'm tired of that, it's too expensive, and you see people say, I don't want to have anything to do with it. So we have to be straight with people telling exactly what everything's for. The Herblax, it was a great thing in 1970s because people didn't know the benefit of fibers, didn't eat much fibers, and everybody was constipated with hemorrhoids. Nowadays, there is more education on fibers and exercise. People are less constipated, and people are more aware, then they require less Herblax. Yes. Alfalfa and the heart plan and the 2 tablespoons of fiber and 15-30 alfalfa a day. 15 to 30 is equal to a large salad. Yes.
I have a friend that does a salt water cleansing drink every morning. That's 1 quart of warm water with a teaspoon of salt.
She has a friend who does salt water cleansing every morning. There's no such thing called cleansing the intestine, number one. It's completely wrong to think you can't clean your intestine. As a matter of fact, that's one thing you don't want to do. You don't want to clean the intestine because intestine is physiology. Physiology means it has to work with the environment's intent. Everything works in harmony with the food together. Once you disturb that with elements, with chronics, with Epsom salt, milk of magnesia, diuretic, catalytic, all of that, you're disturbing that. And the people who are putting this in the market, ideas, doctors or no doctors, are ignorant about the physiology. They need to study the physiology of the digestive tract. If you don't know the physiology, how it works, then anybody can say anything they want to. You cannot have, like people drink vinegar to get rid of something. We have already hydrochloric acid. Why do I need acetic acid? If I need extra acid, why don't I take ascorbic acid, which is vitamin C, which is good for me, better than, see, that's physiology then. You want more acid? I give you more acid until you have an ulcer. How much vitamin C you're going to want? But don't take acetic acid because you're going to have ketosis and you're going to affect your kidney and liver, like diabetic ketoacidosis. So, another people drink hydrogen peroxide. They call oxygenation. Oxygenation. Have you heard about that, anybody here? Drinking hydrogen peroxide. This is dangerous. These people who put that in the market are either ignorant or anti-human race. They want to kill everybody then. There is a big, and they have doctors in these sponsoring these companies. All they have to do is pay somebody $10,000 and he puts his name on it, that he's behind it. But I don't care if he is himself a Nobel Prize winner saying that. It doesn't make sense. Hydrogen peroxide, like cyanide, it kills. Kills bacteria, kills us. Somebody tells me it's going to benefit, I tell them, I think you need to see a psychiatrist because it just doesn't work that way. And the same thing with salt water. Why take salt water when we don't need too much salt in the intestine because of absorption? That is the problem, is people who are sick, for years they have seeked because it's all the fault of the doctors. Because MDs have both the public push them away. Every time a patient says something, doctor, can I take a vitamin? No, you don't need it. Can I do that? No, you don't need it. No, you don't need it. People still sick. Then they go to somebody else who's not a doctor, to seek any alternative treatment, even quackery treatment, or somebody even from Canada mixes orange juice called the KM drink and tell people you're going to get all the energy you want. And he lies, because with the orange juice, he added herbs which had drugs to make them feel good, like tea or coffee. And say, oh, the vitamins is doing it. It's not. The herb, the sneaky herb that he puts in, is what making people feel good, and that's also dangerous. Like Herbalife, I said to her, we cannot depend on Herbalife as a source of energy. And the others selling, that's all they're selling, herbs in KM drink. And people buying that much for $40, $30. And they swear by it. Why they swear by it? Because it has drugs in it, causes addiction. We can put cocaine in drinks and make people feel good also. We can put alcohol. But our job as nutritionists and doctors, what is the best for that person to live healthy life? And that's what we're saying in this lecture. Nothing to do with the sales or any of the gimmicks. Yes?
My husband has a fasted colon, along with a number of other problems that he accumulated from bad diet for a long time. And, so he has a lactose intolerance, a gluten intolerance, along with the, I'm trying to figure out, is there a natural diet that he can go on? He can't eat too much.
Well, your husband he has irritable bowel disease, he had malabsorption, and in plain English, his intestines screwed up, right? And you told him that. Okay. Rather than finding another husband, this is the best way you should do. You should tell him that he should start on the fiber, the heart plan, and the fiber in a small quantity, and build this program like we're saying right here gradually until the intestine gets used to it over 6 months period. But let me finish. The problem with these people, they have such a chronic deficiency of minerals and vitamins in their system because they don't absorb. And what I do in my office, we build them up to give them intravenous vitamins with minerals, like once a week, once a month, once something. Build them up, give them that booster, and eventually the intestine can rebuild itself back.
Just taking the fiber blend.
Mm-hmm.
On that.
Yes.
1 teaspoon of fiber blend in the evening, and replacing that real solicitation. So at least.
Yeah, that's improving. But like I said, it is a complicated, gastroenterology is a specialty by itself. And in 1 hour lecture to our lecture, I want to be able to cover everything.
He takes about 20 different medications, too.
Okay.
One counteracts the other one, and all this.
Well, your husband probably have a problem with the disease and the medication together and the stubbornness in his behalf not to do something about it. Lots of the digestive problem, it can be rebuilt. Even the sprue we talked about, it can come back. Most of the problem can correct. Even the enzymes that's missing, like lactase intolerance among Mediterranean people, Italians, Egyptian Jews, all of the people, they have very low tolerance to milk because they have lactase intolerance. Even though when we take them and give them a little bit milk and more, in about a year, they drink any amount and have no problem. The digestive system is wonderful. It can rebuild itself. You just have to give it at once. And don't go in surgery and have things cut off, like in Crohn's disease or colitis, unless you exhausted every other means. Because once you cut it off, you lost the cells that absorb food. And that's all for tonight. Thank you very much, and have a good night. I have a long drive in the high wind in my van, and let us see how long it's going to take me to make. What?